Hinchingbrooke is a really, really important and well-loved asset in the local community and for its staff. Unfortunately, Hinchingbrooke suffers from RAC.
So Hinchingbrooke Hospital was constructed in 1983 using RAC. Since then there has been further redevelopments in Hinchingbrooke, and as such now the Hinchingbrooke estate is covered by about 75% of RAC panels. RAC stands for Reinforced Autoclaved Aerated Concrete. It is a construction material that was introduced around about 1950. It was seen as an alternative to standardised construction methods, whereby it was effectively cheap and fast to install. However, the RAC itself was only expected to last for about 20 to 30 years. In 2019, through peer review with other NHS trusts, we were made aware of the issue with RAC. And since then, we've worked very closely with NHS England national and regional RAC programme teams to ensure that a programme of risk understanding through surveying and then subsequently risk mitigation has been in place.
So we were delighted in May last year to be told that the Hinchingbrooke Redevelopment, which had been part of a redevelopment scheme, was joining the National Hospital Programme, which is a national programme rebuilding a number of hospitals across the country where there are and have been significant challenges. I think this is an incredibly exciting opportunity for us here at North West Anglia and for the Hinchingbrooke family. In many ways, this is a once-in-a-generational opportunity, and when you get those, you have to stand back and think about what does healthcare look like in the next 40 years. And we have to really challenge ourselves to think about the technology, how buildings have changed, our wider responsibilities as part of hosting the North Place, and the responsibilities and challenges of our local population, health inequalities, prevention. So with all of those things, it makes us stand back and say, what will healthcare look like in the next 40 years? The other thing is, it will attract staff, and nice buildings, an organisation thinking differently and providing different services. It's a great opportunity for us to think about how we can attract and retain some of the most talented staff in the East of England and beyond.
The redevelopment will offer our patients streamlined pathways and a state-of-the-art facility. My role within this is to hear the patient's voice, so to involve them and to understand what they need from our future hospital. It doesn't look very nice. We try our best to cover the props and make it look clean and acceptable, but they are still part of that environment. We also have wards that have had to move whilst RAC work has been done in those areas. During the RAC works, we've been able to use this to our advantage, particularly in areas such as our special care baby unit. We now have a room which can be used to stay with the baby overnight. We have increased capacity and also a parent sitting room and a staff room. So that's been really positive that's come out of the RAC works.
The theatres are truly going to be state-of-the-art. I provide input into how the theatre can be built better to streamline patient care, to give a better experience to the patients as well as to the staff. Most of the equipment is being installed in a pendant fashion such that the floor of the theatre is free for movement of personnel, as well as increasing patient efficiencies in terms of movement in and out of theatre. We have specially thought of our patients, but also of our staff. We've built a large staff room where staff can go rest and relax in between their surgeries.
During the build of our new theatre, we involved patients and we also involved staff. So the public were able to name our crane, Hinchingbrooke Winchy, and we've also involved staff being able to look at floor plans and design through to colour schemes.
Over the last 3 years, the work we've been carrying out has been to ensure that our premises are as safe as possible for our staff, patients and visitors. We will continue to monitor our RAC risk, and we will continue to mitigate where required to ensure that this continues.
Rebuilding a hospital is never done in isolation, and it's really important that we understand the needs of our population, what our patients, carers, families require, and also the broader responsibility and opportunity we have, not just within the local area, but more broadly across Cambridge and Peterborough. This is your hospital, and we need to make sure that it's fit for the future, for the population, for the community, as well as for those that live and work there.